our work is focused on how do we reduce costs and create more efficiency without dampening the incentives to innovate. Because it's very easy for the government to say, let's lower drug prices today, but that could have consequences downstream on future innovation. For example, if we told Apple they couldn't charge more than 400 for a phone, we know over time that would have a real detrimental effect on the pace of innovation. So we have to be cognizant of that. At the same time, we've looked at the supply chain, how a drug gets from the manufacturer to the patient, and we found a lot of inefficiencies and waste. And there's some anti-competitive behaviors in that marketplace that we've tried to expose and show that we can save money without dampening innovation. Another area of my research is focuses on Alzheimer's and dementia, which is one of the um, primary public health issues of the day. Um, and we focus on the economic costs of dementia, which is a little misleading given how it takes an enormous toll on individuals. But the caregiving burden associated with dementia is unlike most other conditions. And so, although the medical costs today aren't that dramatic, the indirect costs on families and labor markets and other types of things have been quite significant. And it's important to quantify that, to put into context what's the value of innovation? What's the value of detecting it earlier in new drug therapies? And because we have a very fragmented healthcare system, most of the efforts are going out treating disease in middle age. So if will private insurers pay for new therapies at age 50 when all the benefits might accrue to Medicare 20 or 30 years later? And so we think about the economics and how do we incentivize payers to pay for innovative new therapies.